How many genes cause congenital muscular dystrophy, CMD? Imagine a complex puzzle made of many pieces coming together to keep our muscles strong and flexible. Congenital muscular dystrophy is a group of disorders caused by changes in at least 35 different genes. These genes are like instruction manuals for building and maintaining muscle tissue. When mutations or errors happen in these genes, the instructions become faulty, leading to muscle weakness and other symptoms seen in CMD. Most of these genes are involved in making proteins that are essential for muscle structure. For example, the LAMA2 gene produces a protein called laminin alpha-2, which helps muscles move smoothly. Mutations in this gene cause a common type of CMD known as myrisin-deficient CMD. Then there are the COL6A1, COL6A2, and COL6A3 genes, which produce collagen type 6. Collagen is like the scaffolding that supports muscles, tendons, and skin. Changes in these genes lead to Ullrich CMD, affecting the strength and flexibility of these tissues. Another important gene is LMNA, which makes lamins that support the nuclear envelope, the protective shell around the cell's nucleus. Mutations in LMNA can cause a form of CMD that impacts the stability of muscle cell nuclei, leading to muscle weakness. Most forms of congenital muscular dystrophy are inherited in an autosomal recessive pattern. This means a person needs to inherit two copies of the mutated gene, one from each parent, to develop the disease. However, some types, like those caused by mutations in the LMNA gene or the collagen genes, can also be inherited in an autosomal dominant way. This means only one copy of the faulty gene can cause the disorder, sometimes due to new mutations that happen spontaneously. Because so many genes are involved, doctors often classify CMD based on the specific protein affected. This helps in understanding the severity and progression of the disease. Genetic testing plays a vital role in diagnosing CMD and understanding the inheritance pattern, which is important for family planning and counseling. In summary, at least 35 different genes have been identified as causes of congenital muscular dystrophy. Each gene contributes to the overall picture of muscle health, and mutations can lead to a variety of symptoms and disease courses. If you or your family are affected, consulting with a healthcare professional and undergoing genetic testing can provide clarity and guide management. Remember, each person's experience with CMD can be different, and ongoing research continues to improve our understanding and treatment options.